Good afternoon. I'm Mick Raich. I'm the owner of Vachette Pathology and Stark Medical Auditing. We look at revenue for our practices, our labs, and health systems around the nation. We're going to talk about a couple different things today. This is our weekly roundup. First things first, COVID's not going away. We're starting to get that as a message now as a population. So what do you do? And when you look at this going forward, the first thing you got to look at is cash is king. If things slow down again this fall, elective surgeries slow down, people stop going to the hospital and stop seeking health care, how does that affect your income? Well, have cash reserves to handle that. That's number one. Number two, build some predictive models. We have something called the COVID curve we built here for a lot of our groups, our practices, our labs. It's a predictive model. We can put your numbers in there and say, hey, if this happens, here's what it looks like. If this happens, here's what it looks like. Imagine a 10% slowdown, a 50% slowdown, and an 80% slowdown, and build revenue models on that so you know how to react. So you know ahead of time what's going to take place. The third thing, it's time to become the COVID expert in your area, in your community, in your health system, in your town, your village. You can do this. This is going to be the focus of our next webinar coming the middle of September. We're going to talk about going into the fall, how to be prepared, and what to do to keep your business viable and what to keep you viable. The second thing I want to talk about, United Healthcare. United Healthcare is not slowing down. It's funny, everybody's suffering because of all these pay cuts, because of work volume being off, but United Healthcare comes out and said they're cutting some of their fees. And we know they're making big cuts to pathologists in the state of Texas, and this will probably be a national plan, so be ready for this. The key in these negotiations, and we do a lot of these negotiations, we've negotiated probably 600 different insurance plans over the last 10 years. The key is having leverage. What do you have on your side of the table? And give us a call. We can help you build that. But that's going to happen. It's going to roll out. You're going to see it take place, so be aggressive. The next thing we see coming out is this whole healthcare transparency concept. It seems like we're still pushing the concept of I know it's one of Trump's initiatives to push transparency for healthcare, for health systems. But if insurance plans know what they're paying 10 different hospitals, and then 10 different hospitals know what the other insurance is paying, is this going to make any difference other than to drive down compensation to the lowest common denominator? That's the scary thing, is that this becomes like a price control, and there really is no room to negotiate. And that's not a good thing. That's not a good thing for anybody. Price controls don't work for anybody. So let's keep an eye on that public transparency and see where that finishes up and where it goes. Another thing, we're still waiting for the physician fee schedule to come out. It was supposed to come out around July 15th. It's been pushed back, obviously, because of some changes. But this had a predictive 9% cut, 8% cut for pathology and radiology together. And that's not pretty. Basically, what they wanted to do is cut a lot of the E&M or cut a lot of the procedure codes and push those towards E&M codes. Now, I can't see where the government's going to say, we're going to hit you with COVID and all that, and then at the same time we're going to give you a 9% pay cut. I don't see that happening. I see this being pushed off. I think the Federal Register comes out in November 11th and around then, and it's going to say we're going to keep things neutral, at least till June of next year, because that'll be a carry-through point. So let's see what happens. See if I'm wrong. Let's hope I'm right, and we don't have to face a CPT code cut going forward. The next thing I want to talk about is Vachette ourselves. We're looking for people. We're continuing to grow. We picked up some really interesting labs we're working with. We're working with some health systems and picked up some work with universities. So if you know anybody out there that's looking for a job and they want to join a great team, Vachette's looking for an auditor, someone who has a CPC, and we're also looking for our next practice manager. We're a small company, 13 people, and we grow a little bit at a time as we grow, and we're looking for that next person. So if you know of anybody, make sure you hit the link below and give us a call. We'll be happy to chat with you. Now, a couple other things. We had a big webinar this week. It was very interesting because we talked about the changes COVID are affecting pathology and lab going forward, but we also had John Harold on from Lighthouse Services, and John talked about building COVID labs. So this is something we've partnered up with them. So if you're thinking about building that COVID lab, you might want to give us a call. We'll run the revenue side. Lighthouse can help you with setup, machinery, reagents, all that kind of stuff. This isn't going to go away, folks. We're going to face COVID going forward. There's going to be a COVID-20. We're going to address every flu season in this manner going forward. So where's your business model there? If you ever thought about opening a lab, this might be the time. Considering also your negotiation strategy with the fact that Quest and LabCorp are at capacity. So who does all this testing? If we want to test 10% of the population for any given disease, that's a big, big apple to bite. The question is, who's going to be the one providing that apple? We want to be the one building labs and helping practices and health systems and individual pathologists build these labs. We have a great partner we're working with. We think that's a great angle going forward. I don't think it's going to go away. If you have questions about that, take a look at our website, and there'll be a link below also for our last webinar. We had a bunch of people on that. And take a look at that. Start thinking. Let's be aggressive. Let's be proactive, not reactive. Again, I'm Mick Raich. I'm the president of Vachette Pathology, and I spend my time looking at how my practices make money, how labs make money, how pathologists make money. We have the Stark side where we look at radiology and OBGYN and other practices. We're involved in this money side. So give us a call if you have questions. We'll do our best. Thanks.